Hello friends, we are going to discuss about sexually transmitted disease. Sexually transmitted disease. First, sexually transmitted disease. First disease is syphilis. First disease is syphilis. Here is least, so less. First point is it is painless. It is painless. Painless ulcer and painless lymph nodes. Painless lymph nodes. Next, it is friendless. It is friendless. So syphilis usually presents as a single lesion, usually single lesion. Next, it is colorless. It is colorless. Colorless means it is in treatment for syphilis, we can use white kit. For treatment of syphilis, we can use white kit. If syphilis affects placenta, it looks like pale. So in syphilis, pale placenta, pale placenta, and white kit is treatment of syphilis. Next point, S. So it shows corkscrew motility in dark field microscopy. Corkscrew motility in dark field microscopy. In dark field microscopy. So here's the important point. It is dark ground illumination is investigation of choice for primary syphilis. So dark ground illumination is investigation of choice for primary syphilis. Next, incubation period for syphilis is 9 to 90 days. Incubation period for syphilis is 9 to 90 days. And extragenital cancri, extragenital cancri. What is the most common site? Most common site is lip. So how it is lip? It is peno-oral route, means blowjob. Peno-oral route, that is blowjob. Next point, secondary syphilis. Secondary syphilis. Here is the important term is called condyloma lata. Condyloma lata. It is flat cauliflower-like mass. Flat cauliflower like mass. And there is another term is called Ollendorff sign. Ollendorff sign. It is deep dermal tenderness over palm and soles. D for deep dermal tenderness over palm and sole. Here is an important term. This is condyloma lata and it is condyloma acuminata. Condyloma acuminata is anogenital warts. Anogenital warts. Human papillomavirus 6. So it is an important point or important MCQ. Condyloma seen in secondary syphilis. Condyloma seen in secondary syphilis and condyloma acuminata is anogenital warts. This is caused by human papillomavirus 6. Next, in tertiary syphilis, we can see in tertiary syphilis, we can see Hutchinson triad. We can see Hutchinson's triad. What is the point of Hutchinson triad? Hutchinson teeth. Hutchinson's teeth. Next, 8 cranial nerve deafness. 8 cranial nerve deafness and interstitial keratitis. Interstitial keratitis and interstitial keratitis. Next, so what is Hutchinson teeth? Hutchinson teeth is widely spaced teeth and incisors being notched. Incisors being notched. This is Hutchinson teeth. Next point is what is the treatment of syphilis? In general, we can use penicillin. Treatment is penicillin G. But after using penicillin G, we can see commonly two complications. First, patient presents with acute psychotic symptoms. Patient presents with acute psychotic symptoms. Acute psychotic symptoms. Patient presents with acute psychotic symptoms. This is Huygens syndrome. This is Huygens syndrome. Or patient can present with febrile reaction. Or patient can present with febrile reaction. This is Jarvis-Herxheimer reaction. There is Rexamer reaction. How you can remember it? Psycho, we generally call in Bengali is hell. Hell, psycho. And in febrile reaction, in Bengali, fever, fever in Bengali it is jar. So there is Herxheimer reaction. So there is Herxheimer reaction. Next point is investigation of choice for primary syphilis. Investigation of choice for primary syphilis is dark ground illumination. Dark ground illumination. So what is the investigation of choice for secondary syphilis? This is VDRL. VDRL. VDRL is also used for monitoring response to therapy in syphilis. For monitoring response to therapy in syphilis. To therapy in syphilis. Next is donovaniosis. 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 If we break the term donovaniosis, there is a no and there is also a term don. So don secretly kill by septicin and hide. Kill by septicin and hide. And this is no. So in donovaniosis, no pain ulcer, no pain lymph nodes, no pain ulcer and no pain lymph nodes. And don't secretly kill by septicin and hide. So kill, this is blood and red. So it is beefy, red, appearance, bleeds easily. It is pseudo bubo and shows septicin appearance. We can remember it in another way. How? This is do means two. B is second letter. So beefy red appearance, bleeds blue, pseudo bubo, B resembles like P. So septicin appearance. So septicin appearance. What is the septicin appearance? It takes staining and over two poles. This is safety pin appearance over two poles. So it is safety pin appearance. If we can remember it in this way, don't secretly kill by safety pin and hide, kill for blood and red. And if we try to remember it, though 2B is second letter, bifid appearance bleeds blue, pseudo vivo and safety pin appearance Next is Haemophilus ducreyi. Next is Haemophilus ducreyi. Haemophilus ducreyi. This is cry. So when children is cry during going to school. Cry during going to school. So it is painful ulcer. It is painful ulcer. It is painful lymph nodes. It is painful lymph nodes, painful ulcer, painful lymphadenopathy. It shows school of fish appearance. School of fish appearance. That is important point for Haemophilus ducreyi or salient feature for Haemophilus ducreyi. It shows bubo. What is bubo? Bubo lymph nodes are painful, soft, and matted together. Bubo means lymph nodes are painful, soft, and matted together. And matted together. So, how we can remember Haemophilus ducreyi? Ducreyi cry. So, cry during going to school. Painful ulcer, painful lymph nodes, school of fish appearance is an important point to be remembered in case of Haemophilus ducreyi. This is bubo. Lymph nodes are painful, soft, matted together. And next point is lymphogranulum venorum. Lymphogranulum venorum. LGV. G stands for girls. Girl has both moods. Both moods. But these moods are transient. And these moods are transient. So LGV caused by chlamydia trachomatis. Chlamydia trachomatis. L1, L2, L3. L2 is most common. L2 is most common. So lymphogranular venerum, G stands for girls, L2 is most common, and G here is group sign. Here is group sign. So girls is both moods. So painless ulcer, painful lymph nodes. Painless ulcer, painful lymph nodes. Next, girls have transient mood. It is a transient ulcer. It is a transient ulcer. And in LGV, we can see saxophone penis. We can see saxophone penis. Saxophone penis. So girl have both moods, transient and talking over phone. So what how we can remember is LGV, lymphogranulum venorum. It is a tricks. Girl have both moods, they are transient and talking over phone. So saxophone pain is transient ulcer, painful lymph nodes, painless ulcer, group sign and chlamydia trachomatis. But in words, human papillomavirus 2 most common. Human papillomavirus 2 most common. Here L2 most commonly associated with LGV and in words human papillomavirus 2 most commonly associated with words. So in LGB L2 in words human papillomavirus 2. Next, so if we sum up these points, how we get it? Ulcer and lymph nodes. Painful ulcer and painful lymph nodes. This is Haemophilus ducreyi. Haemophilus ducreyi. Painful ulcer, sorry, painless ulcer and painful lymph node is LGV. If both are painless, goes for syphilis and donovanosis. So painful ulcer, painful lymph node goes for Haemophilus ducreyi. Painless ulcer, painful lymph nodes LGV. Painless ulcer, painless lymph nodes syphilis and donovanosis. Syphilis and donovanosis. Next is gonococcal infection. Gonococcal infection cause urethritis. Cause urethritis. G. So Neisseria gonorrhoeae is gram negative diplococci. G for G in term of negative there is a G, but not in term positive there is a letter G. So it is a gram negative diplococci, but not positive. Remember in letter positive in word positive there is no letter G. So it is a gram negative diplococci. Gonococcal not affected glans penis, testis, and vagina. And vagina. In gonococcal go. So जो जा रहा है means flow. We can see flow of seeds. We can see flow of seeds. So in gonococcal, we can see flow of seeds. Gonococcal is gram negative diplococci. Gonococcal does not affect glans penis, testis, and vagina. So gonococcal does not affect glans penis, testis, and vagina. Next, vaginal discharge. Next is vaginal discharge. First is candidiasis. Candidiasis. C for cardi and thick. Next, trichomoniasis. 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 F. Fruit. So, strawberry-like cervix. Strawberry cervix. Trichomona vaginalis has flagella. So, Trichomonas vaginalis are flagellated organism. Next, and the discharge is frothy green discharge. Frothy green discharge. How you can remember it also? Just it looks like strawberry. So it is strawberry cervix and green discharge. Next, bacterial vaginosis. Bacterial vaginosis. It is not vaginitis, vaginosis. It is not vaginitis, not vaginitis. So, no inflammation, no inflammation, no itching, no inflammation, no itching. In bacterial vaginosis, there's a two important point. We can see clue cells. We can see clue cells, and here wipe test positive. Wipe test positive. Whip test positive. So in bacterial vaginosis, we can see clue cells and whip test positive. Bacterial vaginosis, not vaginitis, so no inflammation and no itching. No itching. So what is the treatment of this vaginal discharge? Treatment of candidiasis is fluconazole. So treatment of candidiasis is fluconazole, and in trichomonas and bacterial vaginosis is metronidazole. Metronidazole. So in candidiasis, it is treatment fluconazole, and in trichomonas and bacterial vaginosis, metronidazole. Here is the important point. In sexually active young male, most common cause of acute epidermolysis is chlamydia. In sexually active young male. Most common cause of acute epididymoarthritis. Most common cause of acute epididymoarthritis is chlamydia. And in general population, most common cause of acute epidermolysis is in general most common cause is E. coli. So in sexually active young male, most common cause of acute epidermolysis is chlamydia, and in general population, most common cause of acute epidermolysis is E. coli. Is E. coli. So in general, in STD, we need partners treatment, but in which disease we does not need to treat the partners. So first, we does not need to treat the partners. First, bacterial vaginosis. Next, candida. Candidiasis. Next, in herpes. So we does not need to treat the partners in these cases: bacterial vaginosis, candidiasis, and herpes. Next, we are going to discuss STD kits. STD kits. First kit is Grey kit. Grey kit. Just imagine an old patient. Imagine an old patient with gray hair. With gray hair, has bowel and bladder incontinence. Has bowel and bladder incontinence. So gray kit is used for urethral and anorectal discharge. For urethral and anorectal discharge. So gray kit is used for gonococcal and non-gonococcal urethritis. For gonococcal and non-gonococcal urethritis. Next is green kit. Green kit is for vaginal discharge. During menstruation, vaginal discharge occurs. During menstrual cycle, we use sanitary napkins. It is green. Green packet. It is also tricks. So, grey kit tricks is imagine an old patient with grey hair and he has bowel and bladder incontinence. So, grey kit is used for urethral and anorectal discharge. And in case of green kit, it is used for vaginal discharge. Next, next is red kit. Next is red kit. Red kit is for herpetic ulcer. For herpetic ulcer, herpes is painful, angry looking, angry, red lesion. So for herpes, red kit. For herpes, red kit. Next is white kit. Next is white kit. White kit for non-herpetic genital ulcer. Non-herpetic genital ulcer like syphilis. So it is less, it is colorless, so it is in white in color. So it is white in color. So next is blue kit. So next is blue kit. Blue kit for non-herpetic genital ulcer. But those are allergic to penicillin. Those are allergic to penicillin. Those are allergic to penicillin. Next is EOLO kit. Next is EOLO kit. EOLO kit for lower abdomen pain or PID. For PID. PID stands for pelvic inflammatory disease. So PID cause lower abdomen pain. Trick lower abdomen pain. So in lower abdomen, we have bladder, urine, so EOLO. So trick is in PID we have caused lower abdomen pain and lower abdomen there is a bladder and urine is EOLO. Next is black kit. Next is black kit. Black kit for BUVO for BUVO. BUVO sin is Havelas Ducrey. So it is generally painful. It's generally painful. So trick is bubonic plague caused by Yersinia pestis. Yersinia pestis. It was black pandemic. There's a black pandemic. Next, syndromic management of urethral discharge in male is treatment of gonorrhea and chlamydial infection. There is another important MCQ is that syndromic management of urethral discharge in male. Syndromic management of urethral discharge in male is the treatment of gonorrhea and chlamydial infection. Is treatment of gonorrhea and chlamydial infection and chlamydial infection. So there is two important point. Black kit for bubo. Bubo cause generally in Haemophilus ducrei. That is painful. So it is kharab. So it is black. Or you can remember it is like bubonic plague caused by Yersinia pestis. It is a black pandemic. And here is an important MCQ. Syndromic management of urethral discharge in male is the treatment of gonorrhea and chlamydial infection. That's all.